I'm outside of a meeting room, and I've been attending a meeting that Dr. Paul Henny has been giving on co-discovery at the Bob Barkley Study Club. And I'm with a dentist that has been in that meeting for 2 days now, and I'd like to ask her some questions. So introduce yourself first.
My name is Trina Poulsen. I have a consulting company called Infinite Hygiene Consulting, and I'm a dental hygienist.
And you've been a dental hygienist for a number of years.
30 years.
Okay, so you've been in the meeting now for 2 days, and first question is, why did you come all the way from Washington State out here to come to this meeting? What drew you?
One of the concepts of co-discovery hasn't been introduced in school, and I never learned it. And so I came into the concept about 3 or 4 years ago. And I've been continuing to learn more and more and more, and I wanted to come and meet people who have the same inspiration to learn the concepts in a deeper level.
You say you came into the concept. Explain that.
I was introduced to co-discovery instead of co-diagnosis, and I knew that it was different, and so I being exposed to that, I didn't really understand it. So when I first learned it, it was piece by piece, not really knowing how to implement it. And so I kind of came into it and maybe stumbled upon it and liked the concept, but didn't know how to apply it very well. And so it's been something where I keep trying to master it, and I don't think you ever can master it. I think you just get better at it, and it gets more comfortable.
There's somebody watching this video right now that doesn't know what co-discovery is. Give me a couple sentences. To you, what does co-discovery mean with regards to how you relate to your patients?
So co-discovery to me is a collaboration with the patient regarding their oral health. It's inviting the patient into a treatment together so that they're discovering the same oral health needs as you are. And they share the things that maybe you wouldn't know about their habits, their values, their beliefs that have impacted their oral health to the point that you meet them. And then you work together on short and long-term solutions.
So how does this help you as a hygienist?
There's a lot of things that I work on with patients, not only habits, but also belief systems, and how do I impact in my profession change that helps them have good habits for the rest of their life. Because I can't necessarily change the past, but I can influence them in the future and present. So part of it is looking back at what's happened and projecting, but also learning, being curious about the patient and finding out what are their goals? What do they want for themselves? What's important right here and for the future? You know, do they, is aesthetics really important to them? Is function? Maybe they don't want to smile. I've had people walk in with their hand over their mouth. They're afraid to smile. And I think that's one of the most important things when we greet somebody is the first thing that you see is if they're smiling at you. And if somebody is afraid to do that basic thing, that's the gift I feel like I can help somebody with, is that gift of the smile. So.
Well, you've been sitting now for 2 days listening to Paul Henny, kind of the disciple of co-discovery. You've watched Bob Barkley on film. What's a big takeaway? I mean, have you learned anything? Are you any better for this experience? What would you say a takeaway would be?
I have a better understanding of the foundation of what Bob Barkley was trying to teach and to help people understand the philosophy behind a relationship-based care. instead of coming in and telling people what we think should be done, it's the patient knows themselves better than we know them. And we need to remain curious, and we need to be working together with them. And it invites people in. It's not, I think it builds a bridge instead of building a wall with patients. It minimizes biases, judgments, and a preconceived idea of what we think the patient is based on the way they walk in the door.
So you picked up some supporting information because you've already believed this, but you believe it more strongly now.
Oh, absolutely, absolutely. I wanted more tools, and I wanted more information on how to implement it in my practice, and as a practice coach, how to teach it to other practices that are interested in accepting co-discovery as part of their care for their patients.
And you picked up a few more tools?
Absolutely, yeah. I'm walking away pretty excited.
Oh, that's great. Well, there's somebody watching this video right now, might be a hygienist, might be a dentist, who has no clue of what co-discovery is. They're looking at this, evaluating whether they should attend the seminar that Paul gives. Speak to that. What would you say to them? They don't even know. They're just looking at this, wondering if they should get involved. What would you say to them?
I would say absolutely. Any of the tools that we can learn that invites a patient into owning their oral health and that helps us take a step back to seeing the patient as a whole person and promoting health, because we cannot give people health. A lot of hygienists and dentists think that if we drill and fill or we scale some tartar off teeth, that is health, but it's not. The patient provides himself health. We give them the tools by talking with them and creating a plan with home care, with meeting their needs and addressing their concerns. That's what people are going to learn, is how to implement that into their practice and their care.
So you'd say dive in, come find out.
Yeah, I would say come in, learn, because it may not work for everybody that's not ready for it, but it's a tool in your toolbox that you can pull out and use more and more, and you'll be able to become, I think, more confident in using it when you know that it's appropriate. Yeah.
Well, thank you so much.